Medical literature and the wellness market absolutely obsess over the intersection of breathing and digestion. Today, we investigate the real psychophysiology connecting your respiratory muscles directly to your gut microbiome. This bidirectional network links your central nervous system right to your gastrointestinal tract, regulating everything from basic digestion to your immune defense. Is breathwork a rigorous medical treatment or an overhyped commercial trend? You receive so much mixed messaging. Clinical journals document measurable physiological changes. On the flip side, wellness brands market proprietary breathing routines as universal cures. We will strip away the marketing spin to examine the exact neurobiological mechanisms at play. Controlled breathing acts as respiratory vagal nerve stimulation. Think of the vagus nerve as a two-way highway transmitting information about your organs straight to your brain. Volitional, slow breathing stimulates stretch receptors in the lungs, sending signals of safety upward. This process restores autonomic balance and suppresses the release of pro-inflammatory proteins, lowering systemic inflammation. The physiological side provides a specific instructional sequence for rapid parasympathetic activation. First, take a deep, full nasal inhalation. Second, add a rapid, short secondary sip of air. Third, do a slow, complete exhalation through the mouth. Under stress, shallow breathing causes tiny air sacs in your lungs to collapse. The secondary sip reinflates them, maximizing surface area to clear carbon dioxide rapidly. This bidirectional signaling preserves the integrity of your intestinal barrier. Vagal signals release acetylcholine, binding to immune cells to inhibit inflammation. This action preserves tight junction proteins, stopping harmful bacteria from leaching through your gut lining. Simultaneously, exhaled breath contains volatile organic compounds, providing a non-invasive diagnostic marker of microbiome diversity. Beyond neural signaling, respiration exerts physical forces on your anatomy. Deep abdominal excursions physically massage the visceral organs, normalizing intra-abdominal pressure. The diaphragm is the sole striated muscle directly affecting the bowel. Proper movement corrects physical dysfunction, enhancing blood flow directly to the digestive tract. Compare the physical contrast between upper chest tension and therapeutic diaphragmatic breathing. Shallow thoracic breathing creates a rigid diaphragm and elevates intra-abdominal pressure. Deep breathing actively trains and strengthens the crural fibers of the diaphragm, the physical muscle forming the lower esophageal sphincter. Strengthening these fibers significantly reduces the transient relaxations responsible for acid reflux. Clinical trials attempt to quantify these exact effects. In a trial focusing on constipation predominant irritable bowel syndrome, patients practiced inhaling for 4 seconds and exhaling for 6. After 6 weeks, participants showed improved stool consistency and a marked increase in heart rate variability, specifically the RMSSD metric, a key indicator of parasympathetic nervous system activity. Placing clinical certainty against methodological warnings reveals a lack of large-scale, unbiased validation. A systematic review of diaphragmatic breathing for reflux found only 2.12% of analyzed outcomes carried a low risk of bias. Confident claims on wellness platforms often rely on cherry-picked pilot studies, obscuring the high dropout rates common in behavioral trials. Practicing 6 breaths per minute achieves cardiopulmonary resonance, perfectly synchronizing heart rate with respiration. This specific rhythm maximizes respiratory sinus arrhythmia. While researchers debate whether this originates entirely from the vagus nerve or reflects other autonomic functions, the academic disagreement highlights ongoing uncertainties in how we measure nervous system balance. Shifting the lens reveals historical omissions prevalent throughout consumer health sources. Rebranding ancient Eastern practices with clinical terminology obscures thousands of years of historical context. Terms like cyclic sighing or respiratory vagal nerve stimulation replace foundational yogic practices such as pranayama. Academic narrators often present these techniques as proprietary medical discoveries, stripping them of their cultural origins. Corporate entities emphasize accessibility while funneling individuals toward proprietary algorithms. Brands educate consumers on the vagus nerve, framing breathing as a zero-cost biological function. Yet, immediately after establishing this premise, they act as gatekeepers to the correct technique, selling wearable sensors, biofeedback devices, and microbiome test kits. The core message shifts swiftly from accessibility to monetization. To arrive at a synthesized understanding, we evaluate the physiological oversimplifications sold to the public. The autonomic nervous system operates through complex, nonlinear dynamics, not a simple binary switch between fight or flight and rest and digest. The sympathetic and parasympathetic branches often act together simultaneously. Ignoring the mathematical chaos of a healthy nervous system creates a false narrative, reducing human biology to a simplistic switch operated by a proprietary app. Individual biology dictates efficacy. High baseline clinical depression and comorbid diabetes strongly predict a lower likelihood of clinical response, as diabetic neuropathy physically limits vagal nerve flexibility. Incorrect rapid breathing triggers hyperventilation, causing panic loops driven by low carbon dioxide, which ultimately worsens gut-brain dysregulation. This leaves us asking a fundamental question about the future of neurovisceral treatments. If respiration serves as a mechanical lever for gastrointestinal health, who truly holds the authority to prescribe it? The medical community, ancient traditions, and commercial entities all claim ownership over the breath. As we evaluate these interventions, we must decide, are we treating our biology, or are we simply buying back a biological function we forgot how to use?